Turning overseas, China is battling a disturbing new surge of COVID infections. A new study from the University of Hong Kong warns the country could see nearly 1 million deaths from the virus this winter after lifting its very harsh zero COVID policies. Elizabeth Palmer has more.
Official hearses lined up along with private vehicles at the Zhangjiao crematorium in Beijing, almost 2 weeks after the Chinese government abruptly lifted its strict COVID controls, which had included routine mass testing and mandatory quarantine. At the same time, the government stopped counting cases. And as for COVID deaths, the official numbers say there were only 5 today. Social media says different. For example, this video was posted by a user in East Central Henan province, while another working at a funeral home in neighboring Hebei said deaths had increased 5-fold in a week. But there is no way to know for sure. The government has increased the number of so-called fever clinics, essentially drop-in medical centers in big cities, and they appear to be coping. They're for people who don't feel well and believe they need treatment, though many citizens just don't know how to judge after years of being told that COVID-19 is a dangerous killer. While many Chinese pharmacies are completely out of cold and flu medication, state media is pushing the optimistic view. In official videos reassuring people that this huge wave of infection will peak soon and things will be back to normal by spring. For CBS Mornings, I'm Elizabeth Palmer in Tokyo.
Now to China, where a rapid surge of COVID-19 infections is overwhelming hospitals across the country. Some health experts predict China could suffer up to 1 million COVID deaths in the next few months. And this outbreak could also threaten the global economy. CBS's Elizabeth Palmer reports from Tokyo.
Emergency rooms are filled to overflowing. Staff in full PPE are hard-pressed to find enough beds. And the crematorium fires burn non-stop while hearses wait outside. The luckiest patients have access to big city hospitals, but millions don't.
If you go to Beijing, they have so many good hospitals. But if you go to third-tier cities or like rural areas, it's totally different situation.
Social media is brimming with video of the consequences. Morgues so full that workers don't know where to put the bodies. It's almost 3 weeks since the Chinese government abruptly lifted its strict COVID control program with its mass testing and quarantines. It then stopped counting the case numbers, which exploded. And as for the official death toll, according to the government, right now it's a total of 9 since the start of the month. To the Chinese, that's a bad joke. To the world, it's a worry. Both the U.S. and the WHO are pressing China for solid data. China's struggling with the kind of public health emergency America and Europe faced 2 years ago, treating the sick and speed immunizing the elderly. Meanwhile, state media official videos push the optimistic view that this huge wave of infection will peak soon and be over by spring. Elizabeth Palmer, CBS News, Tokyo.
पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। वाव!
Good evening. You're watching Left, Right and Centre. I'm Nidhi Razdan. There is global alarm today as China witnesses a dramatic surge in COVID cases, with some experts and the economists predicting 1.5 million people deaths in China alone. There are horrific reports on hospitals being overwhelmed and staff becoming exhausted. The big concern is whether this will now spread to the rest of the world in the course of the next few weeks and months. Worried here in India, the centre has written to states today asking them to do genome sequencing of positive COVID cases so that new variants can be immediately identified. One of the world's leading epidemiologists, Dr. Eric Feigl-Ding, has called the situation in China thermonuclear bad. This surge comes as the country suddenly lifted COVID restrictions that were in place for the longest time in a population that has not been exposed to the virus the way many in the rest of the world have because of these strict lockdowns, and vaccine efficacy has also been another problem. So what should the rest of the world expect? Well, joining us first on the program is Dr. Eric Feigl-Ding, straight from the United States. Thank you very much for joining us, Dr. Feigl-Ding. We also have Dr. Anurag Agarwal, Dean of Biosciences and Health Research here at Ashoka University. Dr. Feigl-Ding, to you first. You've sounded quite a bit of an alarm there in your tweets as you've pointed out the very grim situation in China. Describe to us how serious it is actually and what the consequences could be.
Yeah, thanks for having me. I think what China is going through is equivalent to what India had during the Delta variant wave of last year. And if you remember, a lot of people died during that wave. China has, for the most part, been avoiding COVID for 3 years almost, other than initial Wuhan. But right now, it's basically the virus is having a burn through, and there's not enough mitigations, and the vaccines are very weak or outdated, and they have very poor booster rates, and so the rollout of vaccines has also been very, very poor in China, and China does not have N95 masks for everyone. It does not have Paxlovid drugs. And in many ways, China's just going through what India and the United States and Western Europe did in spring of 2020. But the thing is, China is obviously a very large country. And with the size of China, 800 million, 60% infected, that's easily, we've seen that easily in many, many countries. But with basically a virgin population of uninfected, we're going to see a lot of deaths. Unfortunately, and that's just what all the models are showing. So short of China reversing course, burn through will definitely cause at least 1 million, if not 2 million deaths.
My goodness, those are staggering numbers. But do we have any idea of what variant is or variants are driving this surge in China? Is there something new that has cropped up, or are these like older variants that have kind of traveled through other parts of the world already?
Well, with the variants race, what happens is older variants are quickly replaced and go extinct. It's almost all new variants. China has a BF7 variant that's predominant, but it's related to the BQ1 variants that's also circulating in North America and Europe. And these are highly evasive variants. They're basically the evade against previous infection, as well as vaccines are not adapted. So, like, for example, U.S. uses BA5 bivalent updated vaccines, while China is still using the Wuhan 1.0 spike protein vaccines. And, of course, their Coronavac by Sinovac is one of the weakest antibody vaccines. Now, China is also rolling out new vaccines, one of which is the nebulized aerosol inhaled vaccine that CanSino has. And these mucosal vaccines that basically protect your mucosa actually prevents infection better than just currently the hospitalization reduction vaccines that currently are being used, these old generation vaccines. So these variants, though, they're inherently evolved to be highly reinfectious and breakthrough prone, because that's what the variants have adapted to our current immunity situation. So I would not say that these vaccines are good enough against infection, but hospitalization, they still protect to some degree, but you need boosters, and China's booster rate is abysmally low, especially in the elderly.
And before I come to my panelists here in India, I just wanted to ask you that how concerned are you that this could travel, to other parts of the world? I mean, we are already seeing rising COVID cases in the US and Japan, and I think in South Korea as well. And the Indian government has flagged this today in a letter to different states to try and up their game on genome sequencing. But are you particularly worried that this could travel now?
Well, I think the BF7 and BQ's variants are already worldwide. I think the issue is that China has not had a burn through like many other countries have. That said, you don't have to have a burn through. South Korea and Japan, they've had milder waves, and they're effectively zero COVID countries, but did not have the burn through like Europe, the US, and India did. So the issue is, I don't think this wave is going to hit other countries as hard as China, because of China's virgin fields of uninfected people and under-vaccinated people. But there is still concern because winter is upon us and hospitalizations and deaths are rising again, in addition to the triple-demic of RSV flu that's affecting Europe and North America.
Dr. Fagelding, do stay with us. Dr. Anurag Agarwal of Ashoka University, also Dr. Randeep Guleria joining us this evening, former director of the All India Institute of Medical Sciences, and he's now the chairman of the Institute of Internal Medicine of Respiratory Medicine at Medanta Hospital. Thank you very much to both of you. Dr. Guleria, how concerned are you then with seeing this surge in China? And if anything, does it underscore the need for us to keep our eye on the ball, to keep checking for new variants, as the centre has sounded the alarm today?
Yes, I think we need to do that. We need to be vigilant and to be able to see whether we are seeing any new emerging variants and whether they are variants of concern and whether they are just causing a mild illness, as we've seen with Omicron predominantly, or whether they are associated with severe illness leading to hospitalization and death. As has already been said, the things are different in India as compared to China for multiple reasons. China had a zero lockdown policy, so they had a large part of the population which was not exposed to the virus as many Indians have been, where you've had infections repeatedly, and therefore you have developed some degree of herd immunity or good immunity in your population. Secondly, we have a very robust vaccination program, and a large part of our population has also taken the booster dose. In China, the booster dose and the vaccination program, especially in the elderly population, has not been very good. It's usually only around 50 to 60%. And the efficacy of the vaccine also is in question, especially against the new variants. So these two factors are driving the current outbreak as far as China is concerned, and they don't seem to be very relevant as far as India is concerned. But having said that, there's always a concern of a new variant emerging. And the world is small. We saw that in December of 2019 and 2020. You travel, the virus will travel with you. And therefore, we have to be vigilant. If there is any cluster of cases, if there's an abnormal behavior in a small area in our country, we should be able to do the genome sequencing rapidly and be able to then develop a clinico-epidemiological profile of any cluster that we see so that there can be public health measures put in place as soon as possible.
Dr. Anurag Agarwal, we are, touch wood, I don't know how else to say this, a little lucky in India at the moment that actually our number of cases and deaths are at their lowest since the pandemic started. I think today's figure was 112 cases in the entire country. I'm sure a lot of it is underreported also. I think a lot of people now are having, colds and coughs and are not necessarily testing, but it's still much, much, much less than what it was, and long may it stay that way. But are you at all concerned that new variants could emerge? And are we doing enough on genome sequencing? Is therefore my question. That, have we really done enough already, and do we need to step up on that?
Great questions, Nidhi. I'll reiterate what Dr. Guleria said. Vigilance without fear is the way to go for India. And I would agree with everything that Eric said in the beginning, that in any country where there are a large number of older, poorly immunized or non-immunized, non-infected, high-risk people, Omicron can be devastating. We saw this much earlier in Hong Kong. Hong Kong being a part of China, recapturing the type of population, but of course much denser, was the first example that Omicron is not nature's vaccine. It is not benign, and in the right population can cause severe healthcare stress and deaths. Now, the question you're asking regarding how this would go and what we need to worry about, are we sequencing enough? Let me first start by saying that as a globe, we are nowhere near sequencing enough. Sequencing has really dropped tremendously all over the globe. And in some parts of the world, we don't have enough data coming out. In China, we have limited data. What looks like it's growing in China is BF.7, exactly as Eric said. India has already seen BF.7, as has America, as have many other places. It by itself does not appear to be very different from other things like BA.5, BQ.1 that we have seen recently. Even within India, sequencing is heterogeneous, testing is down. Rapid antigen tests are not very suitable for sequencing. RT-PCR testing is very, very down. So to improve our sequencing, we have to improve the testing. And we need to come out with a plan that either does random sampling and testing. For example, in UK, they have had cohorts where they simply randomly test a certain number of people to know the true number of infections and the true prevalence of the various lineages. So yes, we can do better, but I think from a fear point of view, no, I'm not afraid.
All right. You mentioned the sort of lack of perhaps correct information on variants and perhaps even, numbers. And Jennifer Zeng is joining us now. She's a Chinese-born human rights activist and author and blogger. She's joining us from New York. Jennifer Zeng, how much is actually China underreporting the COVID crisis at the moment? And how much of this information is being controlled?
I don't know how much. The official report is only 2 days cases for the entire China. But we know only in Beijing, all the crematoriums are operating 24 hours, and they have a capacity to handle 4,000 bodies per day. But still, there are a lot of bodies that can't be handled, and people have to wait for as many as 7 days to get a body burned. And in the black market, some people are asking for 15,000 yuan to get a body cremated because the service is rare. So that's how much how much the difference was. So in one city in Beijing, there could be over 4,000 deaths per day, but in the whole nation, they are only reporting 2 cases. So that is a very, very worrying situation. Like the experts said, it will prevent us from knowing what's really going on in China, and that will in turn endanger the whole world.
Absolutely. Dr. Feigelding, just a last comment from you on China itself. What does China do in this situation? Because obviously those strict, complete lockdowns have backfired. People have come out and protested. They've been a humanitarian disaster, actually. But I mean, this is awful. So what does the Chinese government do?
Yeah, I think China's government, first of all, it needs to really increase its booster rate, but also roll out more of its inhaled vaccine, the mucosal vaccine, because you need to stop transmission. Stopping transmission is the key, not just reducing severity or finding treatments. That doesn't slow the infection. I think, first of all, they need to give out N95 masks for everyone. They need to mandate it in public spaces, not just surgical masks. And in addition, I think they should have ventilation and air disinfection. They should have, in all the crowded Chinese shopping centers and classrooms, they should install either HEPA filters or upper room UVs that can disinfect the air, or have very strict ventilation standards. But I know that's hard in the winter. That's why air disinfection is really key. And those are like cornerstones in other countries, ventilation and air disinfection, because it's an airborne virus. And I just want to point out, I've had planned interviews with China, but the thing is, most of the staff in their Beijing office are actually sick. So, for China to say there's only 2 deaths whenever, most of their media crew is even sick, that just shows how out of control the spread is in China.
Absolutely. Dr. Guleria, just a last comment from you then. We are all sort of at ease, as I said, here in India. People have stopped wearing masks by and large. We don't even require to wear them on planes anymore. I still do it. I'm still a little paranoid on a plane and in crowded spaces. But what's your advice to people at this time? I know we don't want to panic, but, is it stupid to think of wearing a mask in crowded places? I know people look at you funny, but it might be the best way to protect yourself.
No, I don't think it's stupid at all. And I think prevention is better than cure. So I think, considering how the situation is, it's very important that we have COVID appropriate behavior. And I would say especially the elderly and those who are at higher risk with comorbidities. And I would also say that those who have not got themselves vaccinated should come forward and take the booster dose, because in the last few months, there has been a feeling that now the pandemic is over and we don't need to. This is a wake-up call for everyone, that you need to get yourself vaccinated and you need to have COVID appropriate behavior. It's not over as of now.
Right, and thank you very much to all of you for joining us. As we speak, a breaking news flash coming in. India's health minister will be holding a meeting on COVID tomorrow in Delhi. We'll have more on that in just a little while. So the government of India clearly not taking any chances given how things have panned out in the last couple of serious waves that we have seen, COVID waves. And even though cases in India are at their lowest right now since the pandemic started, the government not taking any chances and trying to put precautionary measures in place. So that meeting called by the Union Health Minister will take place tomorrow. We're also joined by one of India's leading virologists, Dr. Gagandeep Kang. Dr. Kang, how concerned are you by this COVID wave in China, which experts are saying could be the first of 3 very big waves to come over the next few months?
Well, I think the Chinese population is at a huge disadvantage in not having been exposed to the virus previously, in having relatively low levels of coverage of boosters and in the wide use of inactivated vaccines, which are good, but not as good as some of the alternate vaccines in the market. It's also winter, and this is a time when 3 viruses circulate at high levels. In the rest of the world, we are seeing a lot of COVID-19, but also we've seen a lot of influenza and a very high respiratory syncytial virus season. So you're getting 3 viruses together, potentially in winter, in a population that has low natural immunity and low levels of boosting. That's a concern. Where we are lucky is that we are dealing with Omicron and not with the Delta variant.
Is there any kind of news on what kind of variant this is in China, or variants, whether it's different from what we've seen in other parts of the world?
Well, the variants that are circulating now in China are very similar to the variants that are being seen in other parts of the world. Essentially, they are subtypes of Omicron. And because it is a subtype of Omicron, and most Omicron variants have tended to be milder than other variants of the virus, there is some hope that it will not be as bad in terms of severe disease and deaths as an alpha or a delta variant might have.
But then why is it experts are predicting such a high number of deaths in China? Is it because the elderly there are not, fully vaccinated?
The elderly population has low levels of boosting, so that is a significant concern because we know that age is the biggest risk group for severe disease and mortality. So if we could get boosters into that population as quickly as possible, that would be great. It would have been better to have boosted first and then opened up. That has not been the case in China. The vaccines that are being used there are inactivated vaccines, and while they give reasonable protection against severe disease and death, they don't necessarily protect very well against infection. In any case, with Omicron, it is quite difficult to protect against infection. Why there are predictions for high rates of cases and deaths is because of the sheer numbers that we are talking about. China has the biggest population in the world, and this is a population that has not experienced multiple waves of infection, unlike what we saw in India. So if you remember in India, in January of 2021, about half the country, 2022, half the country got infected. But because we had all been vaccinated, because there were reasonable levels of infection previously, we saw an upsurge in hospitalizations and in deaths, but it was nothing like the rates that had been seen in April of 2021.
Finally,
China does not have that advantage.
Right. Finally, Dr. Gagandeep Kang, India is seeing its lowest cases since the start of the pandemic at the moment. Do you see this sustaining?
Unless there are new variants, that can transmit even better in a vaccinated and infected population. It's unlikely that we will see humongous change. But this is a virus that evolves and new variants appear unpredictably. So the one thing that we should be doing is making sure that we have a systematic surveillance system that functions at a high level and that we continue to sequence whatever viruses we identify to make sure that we are not missing anything. The other thing to watch out for is clusters of infection. Severe respiratory disease coming into hospitals is a signal for what might happen in the population at a later stage. This is, bog standard surveillance. We need to continue to do that and not take our eye off the ball.
Fingers crossed. Dr. Gagandeep Kang, thanks very much for joining us. Thank you.
Thank you. Bye.
我们把一些消化内科、内分泌内科，还有风湿免疫科这些日常慢病的管理的病房合并。合并以后呢，第一腾出了空间，腾出一部分病房的空间，来改造成临时 ICU， 来分流急诊这些患者，尽最大努力拓展医院在极危重症方面的空间，尽一切努力能够使急诊室能够有一些空间的储备，能够腾挪出来，来抢救更多的极危重症的患者。